Hydrops Fetalis is a serious condition where an unborn or newborn baby's body accumulates too much fluid. This can happen in different parts of the body, but it's most often seen in the abdomen, near the heart and lungs, and under the skin. If not treated, the extra fluid can put a lot of strain on the baby's heart and other important organs, posing a serious risk to their health. During pregnancy, Hydrops Fetalis can cause the following symptoms. More amniotic fluid than usual. Thick placenta. Enlarged spleen and heart. Fluid buildup around the baby's organs, heart, or lungs. After birth, Hydrops Fetalis can cause pale skin, excessive sweating, difficulty breathing, enlarged liver and spleen. There are two types of Hydrops Fetalis. Non-immune hydrops is the more common type, occurring in about 80 to 90% of cases. It's caused by a genetic disorder or congenital disability that interferes with the baby's ability to manage fluid. Immune hydrops is rarer and occurs when there is an incompatibility between the red blood cells of the mother and baby. For example, when a pregnant woman has Rh-negative blood and her unborn baby has Rh-positive blood. The mother's immune system treats the baby's Rh-positive red blood cells as foreign invaders and sends out antibodies to fight them. This leads to the destruction of many of the baby's red blood cells, causing a medical condition called anemia. If the baby becomes anemic, it means that it lacks enough healthy red blood cells to carry adequate oxygen through its body. In some cases, anemia creates only mild to moderate health problems for the baby. In other cases, anemia can lead to life-threatening heart failure. Hydrops Fetalis is not a disease on its own, but it's caused by other medical conditions and complications. Here are some of the main causes. Hemolytic disease of the newborn, also known as erythroblastosis fetalis, is a blood disorder that occurs when the blood types of a mother and baby are incompatible. Severe anemia, which happens when the body has fewer red blood cells than normal. Red blood cells carry oxygen throughout the body, so if there aren't enough of them, it results in anemia. Infection present at birth can also cause Hydrops Fetalis. Heart and lung defects in the baby can be contributing factors. Birth defects and congenital anomalies in the baby can increase the likelihood of developing Hydrops Fetalis. Liver disease in the child can lead to Hydrops Fetalis and often shows up as jaundice, swelling in the abdomen, fever, and pain. When it comes to diagnosing Hydrops Fetalis, your doctor will typically use a routine prenatal ultrasound to look for abnormal amounts of fluid in your baby's body. This could be found in two or more areas, such as the heart, liver, or spleen. They may also check for other symptoms like a large amount of amniotic fluid or a thickened placenta. Additionally, blood tests can be used to reveal any red blood cell incompatibility between the mother and baby. If Hydrops Fetalis is diagnosed during pregnancy, it may not always be treatable and could lead to early labor. If a baby is born with Hydrops Fetalis, they will require specialized medical care. This may include the need for a breathing machine, ventilator, and the use of a needle to remove excess fluid from around the baby's heart, lungs, and abdomen. The baby will need to stay in the hospital under close observation by the medical team until the underlying disease causing the Hydrops Fetalis has been stabilized.